Hi, welcome back to our series working with runners and our top tips for therapists. And in this episode, we're going to be looking at hamstring care. In previous episodes, we've looked at sort of more lower limb aspects of the calf complex and Achilles, and we've even looked at the anterior hip in another episode. This time around, we're going to focus on the posterior thigh, which is the hamstrings. There's a variety of different techniques that we can use and implement in this area. And I feel that quite often with runners or clients that are runners, hamstrings is a really big area to work on with them to help maintain that mobility and to help with the recovery in that region as well. It can be really, really useful area to work on. So let's start off with just a little bit of effleurage and compression in that area to see as a bit of palpation. And Paul, if you wouldn't mind just putting your face down into the hole there for me. Beautiful, good. So again, as we've done in a different series, a little bit of palpation work, and that is working with some compression. Now I have previously said as well that I like to offload that area by taking out any tension, so giving the tissue some slack. And by that, this occasion, what we'll need to do is just bend the knee. Taking up the correct stance and base for here, I'm just going to come across and apply a little bit of transverse compression just to start to palpate and warm up the tissue. Using my body weight and the push from the back of my leg to gain my depth here. So then also for the purposes of the video, I know that we've just administered compression to this thigh, however, this hamstring, I'm going to come and show you some effleurage on this side so that you can see what I'm doing in the video. So I'm just going to expose Paul's leg here. And as we sort of mentioned in all of our videos, by the way, we have obviously with our client gone through an in-depth and thorough medical intake and assessment with them and ruled out any red flags, and that these videos are very much intended as a support tool to your existing knowledge already. So from here, we're starting to apply some effleurage to the hamstrings, moving from our base, so pushing off from our back leg here, going through the full length of the hamstring, really making sure that you don't just sort of stop halfway down the thigh. Because remember, the hamstrings go all the way up in underneath the glutes. Obviously, we're not going to go as far as the glutes, but we're just going to go below. Okay, effleurage is a fantastic introductory technique, warming up the tissue, introduction to touch, but also it's a fantastic palpation tool as well. From here, I might go a little bit deeper now that I've warmed the tissue, so I might go in with a gentle fist into that area. I'm only going to be at this point, though, with this particular applicator, access more the lateral aspect of the hamstrings here. And I'm going to go slower because, as we've mentioned in other series, when you start to use something that's more specific and deep, or a deeper technique, I should say, you want to go slower. So really taking your time. And also you're going to be checking in with your client to make sure that the depth is appropriate for them and that it's not uncomfortable. But as you can see, nice, strong, straight arm integrity through my wrist and gentle sinking in into my fist. Now, I'm not trying to create a fist that looks like this. I'm going to maybe punch something into the bed. It's a very soft wrist. So I was just sinking that in with my body weight to go through the back of his hamstrings here. And still pushing with my back leg. There we go. And then following that back up with a more superficial and broader technique. We can look at applying as well a little bit of Petrissage to create some space and lift within that tissue. So slightly different from effleurage, and I'm probably not going to work with the lower third or lower half of the hamstrings at this point with this technique. Hopefully you can see what I'm trying to demonstrate. And actually, I'll come over to the other side to show you, is this lift through the tissue here. And I'm being mindful as I'm applying from this side of the bed that I'm obviously coming around through the front of the quad here. I'm being mindful as I pull back over the IT band that I release a little bit of pressure and depth as I pass over that area. But it's this equal push and pull again as we go through the lower or distal fibers of the hamstrings. Now, another technique that is really, really lovely in a prone position with your client is some soft tissue release. The traditional soft tissue release will be a longitudinal application, which means it's going in the direction, generally in the direction of the fibers. If I was to do that with his hamstrings, it's a little bit difficult because essentially I'm only going to be able to get the lower portion or the distal fibers of the hamstrings, where I want to be able to get more into the mid belly of the hamstring. So in order for me to do that, I need to apply my pressure through a transverse application. And in order to prepare, that's why I've prepared the tissue, I've warmed it up, but I now need to take the slack off of, create slack in the tissue or create slack in the hamstrings. And I can do that by bending the knee because of where the hamstrings attach into the lower leg underneath or past the knee joint. So from here, I'm going to keep hold of my client's ankle here. My body now, and again, going back to body mechanics, my hips now need to get behind the direction of where my pressure needs to go. So I'm going to take my stance, quite a long stance here, to allow my wrist to not go into overextension and pressure. I'm going to sink down into the mid belly, and as you can see here, my wrist stays relatively open, and I'm sinking down. By sinking down into my legs, I'm bending down through my front knee. My back heel is lowering, so that means I'm starting to take up a little bit of slack. I've got my lock now, and I've created this lovely almost C shape with the hamstrings themselves. So from here, as I sink down into the hamstrings, the next movement that I want to do is I'm going to pull this foot here towards me a little bit. It shouldn't have to move very far. So now that I've got my lock, I hold that lock and I pull his ankle towards me. And I just want to feel a gentle stretch in that tissue. So it's not much. The move is not much because I'm being mindful as well that I'm not going to over-exert or put too much exertion and rotation on that knee joint itself. So again, I'll come a little bit lower down in my fibers that I'm working with here. So as you can see, sink down, open, nice strong open wrist here. Pressure and slack is taken up with my body weight pushing forward, and take that knee or the heel towards me, which is encouraging internal rotation of the femur here. And again, the movement doesn't need to be big. So if you have the right lock in place with this transverse STR, the movement doesn't need to be very big at all. Now, the next move that we can show you is a lovely stretch using a muscle energy technique for the hamstrings. I'm going to turn Paul into a supine position now.